This is Dr. David Pomeroy, your host on ADHD Focus. I wanted to remind you that the show is not intended to be a recommendation for diagnosis or treatment of any condition for any specific person. Please consult your mental health professional or doctor managing your ADHD or mental health issues about any diagnosis or treatment-related information that you hear on the show. Refer your ADHD provider to the show if he or she would like more information. Thank you. And today we're talking to Roberto Olivardia, who is a clinical psychologist and lecturer at the Department of Psychiatry at Harvard Medical School and also has a private practice in the Boston area. One of his areas of expertise is in what's termed body dysmorphic disorder, which is a preoccupation with how your body looks and trying to alter that, but not in healthy ways. It does intersect with ADHD for a number of reasons, and we'll be talking particularly about that. So looking at some resources that can help anybody try to figure that out. So Roberto, welcome to the program.
Oh, thank you for having me. It's always a pleasure.
And I understand that there isn't a lot of general knowledge or general information about this issue out there, but you wrote an article for Attitude Magazine about it. How does BDD show up in ADHD, or how is the ADHD kind of a risk factor for it?
Sure. My interest in this actually comes from my area of specialty as I work particularly in the area of body dysmorphic disorder, body image issues, and specialize in the treatment of boys and men with eating disorders such as anorexia nervosa, bulimia nervosa, binge eating disorder. And through my clinical practice have seen this high prevalence of boys and men with ADHD who also have body dysmorphic disorder, or BDD as we call it for short, or eating disorders, and looked into the scientific literature, and there's a number of studies that have been published on the correlation of ADHD with binge eating disorder, bulimia nervosa, but not on BDD. And just to be clear, that what we're talking about with body dysmorphic disorder is that it is a psychiatric diagnosis that's characterized by a preoccupation with a body part or parts in which the individual thinks that that body part is ugly, is defective in some way, is deformed, despite the fact that other people and objectively it is not sort of seen in that way. So these are not individuals who say, oh, I don't like the way my nose looks. They say, I hate the way my nose looks. It looks alien. It looks disgusting. I'm totally repulsing people. I should kill myself because I look this ugly. And these are individuals that, or even if, let's say, they have a particular flaw in their appearance, such as a man who might have thinning hair, he doesn't see it in the same way that he would see other men whose hair is thinning. He might say, well, they look okay, but I look just disgusting. Like, you'll often hear words like gross, repulsive, disgusting, ugly.
So it's really on the extreme.
It's a very large extreme, exactly. And these are individuals who, if they have the financial resources, are often presenting themselves in cosmetic surgery clinics before they come in to see a therapist like myself that specializes in BDD. Lots of people who have those resources there's a term called a polysurgery addict, people who are basically addicted to cosmetic surgery. And you'll find that a number of people who fall in that category have body dysmorphic disorder. It has one of the higher suicide rates of psychiatric illnesses. About 20% of people with BDD commit suicide.
Wow.
It is a very, very serious, very tormenting diagnosis that affects 1 to 2% of the general population. So it's out there. And contrary to what people might think, it is equally distributed amongst genders, meaning that 50% of men and 50% of women, 50% of individuals with BDD are male and 50% of people with BDD are female. So it's not like eating disorders, which although again, I specialize in the treatment of boys and men. There are a lot more males out there than people think that struggle with eating disorders.
Right.
But as far as BDD, it is an equal gender distribution.
So what are the factors in ADHD that may, I guess, predispose someone to the BDD issues? We talked some about the failure and low self-esteem being one of the drivers.
Absolutely. The patients that I see, that the certain risk factors are that individuals who have severe executive functioning deficits, who basically are used to a way of living where they put in so much work into things and they're not getting back the feedback, that is sort of commensurate with the work that they're putting in. And so they experience a lot of failure in their lives. And as a result, it affects their self-esteem. It affects their ability to feel like they're good at something. And so many of my patients who fall in this category say to themselves, it's sort of this negative thought spiral of, I'm not smart, I'm not going to be the smartest, I'm not the most athletic, I might not be the most socially with it individual, all of which ADHD can sort of affect all of those venues. But if I can be the most beautiful, the most handsome, the most muscular, the person that's the most attractive, that can buoy my self-esteem. That becomes my identity, because I'm, as far as other things are concerned, I feel worthless. And so it makes sense in the sense that then the attention to appearance, the attention to weight, to all of those things become that much more important to them. And, in the case of our bodies, I mean, there are things, particularly if you take eating disorders, for example, when I've treated individuals with ADHD and anorexia, for example, that they will say, there's something about, when you're restricting and then you step on a scale and the number is lower, it is a very cause and effect relationship. Exactly. That feedback is so concrete. And the brain, the ADHD brain, craves that. We crave that kind of feedback. And it's almost like the brain isn't making a discrimination at that point of, wait a minute, but this is unhealthy feedback. It just knows it as feedback. And it's incredibly rewarding. And so when the brain gets that, it wants more of that. And on top of that, if people with ADHD do get attention for, wow, you're thin, or you're really
fast,
muscular, right? You're fast, or I treat men who take anabolic steroids and compulsively lift weights, at the gym, and they, the feeling of, I'm putting in hours at the gym and I'm getting all this feedback and people are noticing that, is incredibly rewarding when you come from life experiences in which you feel like you're overlooked.
Yeah. And certainly something that's a very common background belief and driver to behaviors in people with ADD is that feeling of, I'm not good enough. And it may not have been specifically parents criticizing, but everything from, some things about parents or teachers, you're lazy, you're not motivated, you're not trying hard enough. And so this belief grows and takes root there of, I'm not good enough, and people, I think, either then work harder, stay up later to do homework and things like that. I'm going to prove I can get an A or get into this really prestigious college, or they give up and escape into addictions and depression and things like that. And it sounds like the BDD is, in a way, an escape, and it's also one where they get that instant gratification of, wow, I trained for this 5K, I finished it, and I can do better. And so they get into overtraining. Plus there's just with exercise, you feel better, there's increased dopamine, so maybe you can focus better. So there are a lot of different things I can see that fit in with ADD.
Oh, absolutely. And, and I can tell you, just personally as someone with ADHD, that, the analogy you mentioned about the running, I run in races, and, when I completed a half marathon, it was an exhilarating feeling, the feeling of like, wow, like I actually did this. Like I never thought, if you had told me 5 years prior to that I'd be running a half marathon, I would have thought you were crazy. And the fact that I trained for this and it paid off and I was able to do it and I recovered very quickly from it, in this way, it was a high, it was a real high. And I could easily see, just like anything that could sort of be an addictive sort of, draw, that it could be something like, well, then let's go, to the next thing.
Do some more.
And let's do some more. And not that there's anything wrong, let's say, with running a marathon, provided that you're doing it healthily, that you're eating well, and that all other parts of your life are in check, are in order.
Yeah.
And the patients that I work with are patients that, let's say, might be working out at the gym 4 hours a day, and they're not attuning to their other responsibilities in life because they don't feel it's going to matter, that they're not successful at those things anyway. And this is the thing that they're funneling their whole sense of identity into, which is very problematic.
And then they're going to run into the kind of the negative feedback part, because then they aren't spending the time with family or on their career or whatever, so they aren't doing as well there, so they get more of that failure. But boy, I can be a success at the gym or with running or being thin, and so they each that behaviors drive two different spirals, kind of.
Oh, absolutely. And where it can really, I mean, a lot of times when I see patients who engage in these kind of behaviors, that where they come to my office is when, let's say, they've had an injury and they can't work out at the gym. And then they get suicidal and very depressed, because to them that's the only thing that has made them sort of superficially felt valuable or worthwhile. That's the thing that sort of, and people have told them this isn't healthy, and they thought, well, you don't understand. I know what's making me feel good. And similarly, with something like anorexia, that a lot of times it's when people realize, wait a minute, I'm dieting down now to, I've seen men and boys who are dangerous, I mean, literally on the verge of death, from the eating disorder, and then think, at some point the insight finally comes in, not all the time, but that says, wait a minute, I'm less happy at 80 pounds than I was 20 pounds ago when I was 100 pounds. And so, wait a minute, something is wrong here. Something is very faulty, in the thinking.
And the two things I think of that, again, are kind of ADHD characteristics. One is that poor internal awareness, almost like the poor time awareness, but there's not a good self-awareness of one's behaviors, or that, oh, this really isn't a healthy pattern, which gets around to the executive function things that don't work well with ADD.
Absolutely. That, in the field of eating disorders, we see that individuals with eating disorders in general, with or without ADHD, have what's called poor interoceptive awareness, which is what you were referring, this sort of internal awareness of, am I hungry? Am I satisfied? Am I tired? Like all of the cues that we have to, in a sense, be attuned enough to our body to pick up on. And people with ADHD have poor interoceptive awareness. We're individuals that are externally oriented. We're oriented by what stimulates us on the outside. And so it's very easy. We see all the time people with ADHD, for example, who can hyper-focus for hours and hours and hours and don't realize that they haven't eaten in 12 hours. They haven't gotten up to go to the bathroom in 12 hours because they're so locked into a task. And then what happens is once that task ends, they're just starving, or they realize they're about to, lose control of their bladder, in their pants.
Yeah.
So when you have people with ADHD and these eating dysregulations or body image issues, it's like a double whammy, in the sense that they aren't as attuned to their hunger cues, their pain cues. With individuals with ADHD who engage in very unhealthy exercise behavior, for example, they're not attentive to the fact that their arms, their legs, like all the sort of pain cues that someone would get to say, whoa, okay, I'm going to end this workout right now because my body's in pain. They don't feel that until after the fact, maybe the next day. And then unfortunately their brain says, well, no pain, no gain. Maybe this pain is an indicator that I'm doing something right.
And if I work out harder, then I won't have as much pain when I do that much. So
exactly.
Get into that cycle.
Right, or the pain is quickly eclipsed by the visual that if, let's say, they look in the mirror, a lot of people with BDD, for example, engage in excessive mirror checking. So they're always looking in the mirror for that visual feedback, that visual data. So if you're looking in the mirror and you see that your bicep is getting bigger, it's almost as if all that pain is now out the window, because that incredible high, that sort of dopamine elevation that you get from, wow, like this, working out has resulted in a bigger bicep or six-pack of abs, then it's almost as if that pain is forgotten. And so it's almost like the ADD brain is just going towards the shiny part of it and not sort of the darker part of it.
So that's, say, a family member or friend notices, boy, you're really out there talking about things being disgusting and gross, or losing a lot of weight, or one thing or another, hearing about the 4 hours at the gym, I would think that just kind of confronting that person or saying, gee, don't you think that's a problem, probably isn't going to make a change. So what can, say, a family member do? How can they approach this in terms of helping the spouse or child or parent deal with that?
Sure. That I think it starts a conversation with what you're observing. So, for example, if you're saying, I noticed that, you spend a lot of time at the gym, or I noticed that you don't eat much, or that you skip a lot of meals. I've noticed that you've lost a lot of weight in a way, and it's important to say, in a way that doesn't look very healthy, because people with anorexia, when they hear that they've lost a lot of weight, they equate that as a good thing.
Yeah.
So you want to say it looks unhealthy, like it doesn't really look good in some ways. So first, sort of just share your observation, and then it comes down to thinking about it in these four categories. One is basically comment on how whatever behavior they're engaging with is getting in the way of either their occupational functioning, their relationships, or other things that are important to them. Because in the end of the day, people who engage in these body image, obsessive behaviors, eating disorders, ultimately what they want is what we all want. They want to feel confident. They want to connect with people. They're not exercising for the sake of just being a size 0 or having big muscles just for the sake of having big muscles. They're looking for connection. These are individuals who are either lonely or anxious or depressed, and they're looking for something to give them some self-esteem ultimately, so it's a currency of connection. And so when you can point out to them to say, it's interesting that you're at the gym and you don't have any time left for your friends or your family, that it's helping them point out almost the kind of irony of these kind of behaviors. And I've had many patients I had a patient I remember many years ago who would be at the gym 5 hours a day. He was in so much pain after the gym that he couldn't even move. I mean, literally, he would just go to his apartment and then he got addicted to painkillers because the pain was so great, and then he became an addict on heroin. I mean, it just became this terrible cycle. And I said, what are you doing all of this for? I mean, really, what? And he said, well, I want to be attractive and I want to, get chicks, was his actual quote. And I said, well, but let's think about this. I mean, you're not in a position where you're not putting yourself out there. The only place you are putting yourself out is at the gym. Secondly, you're in so much pain that you couldn't even go out on a date, after that, with that kind of behavior. And you're feeling so bad about yourself if, let's say, you don't do this obsessive workout routine. And he didn't even know how to relate to anyone because his world was the gym and muscles and protein supplements and all of that. And when he realized that, he realized, wow, like it's almost, it became this moment that, well, of course, that's obvious, but it isn't to individuals who are engaged
when you're
in this cycle.
In the middle of that.
Yeah, and so when you can point out to people, look, this is, I feel like I'm seeing that you're not going out with your friends as much, you're not having as much fun, or when you can't get to the gym, or if you, let's say, if somebody ate more than they wanted to for a holiday and they were depressed because they put on a couple pounds, that's, I notice you get really upset, and I don't know, that's just something, it seems like something has sort of a power over you. Because the most important thing to say is that, of course, eating healthy and exercise are wonderful things, that it's not about, because a lot of times these individuals hear feedback and they think that what you're telling them is that it's okay to be overweight and to be a couch potato. And that's not what we're saying, that that we, of course, want to eat healthy, but too much even of a good thing is not
balance.
good. There's a balance.
And people with ADD certainly are not likely to have a balance of work and relationships, any of those kinds of things. One of the things that strikes me that's really important in terms of someone making just observations is to not follow it up with any kind of a judgment statement in terms of, and that's unhealthy, and you should do something different, or whatever. And, if you keep doing this, then you're going to end up one thing or another. That has to not even be part of it. Even if the person giving the feedback has that fear that those things may happen, don't say it then, because it's going to get in the way of what you really want to do. So you mentioned there were four aspects or four things. So that objective observations is one.
Right. So sort of commenting on, this is affecting your functioning. The other thing would be basically how much of their self-esteem or self-worth is based upon this. And I like what you said, and I agree with it, because it's not so much a judgment, is more just saying, wow, that must be hard to feel like you have to be a certain size or exercise a certain amount or be a certain weight in order to feel acceptable. That's hard. Like almost empathizing with the person and saying, like, these are people who are hurting. These are not people who are vain. There's a big, particularly with body dysmorphic disorder, people with BDD get accused of being vain because they're mirror checking, and this is not vanity. These are not narcissistic individuals that say, I love the way I look, so I'm going to look in the mirror as many times a day. They're looking in the mirror because they're so fearful that they look disgusting in that moment. And so I would empathize, with that and say it's hard, like this other category of how much of your self-worth and self-esteem is based upon that, because healthy self-esteem is something that we want, based upon lots of different things, but particularly we want our self-esteem to be based upon things that are more sort of crystallized in our life, our intelligence, our ability to relate to people, things that pretty much are going to be the same throughout our life. Body image and our appearance is probably one of the worst things to base a large percentage of our self-esteem, because guess what? We're all going to get old. We're all going to get wrinkles.
Yeah, it's all going to change. Yeah.
It's all going to change. And if you're the bulk of your self-esteem, and it's not to say some of your self-esteem can't be on the way you look, sure, but if the bulk of it is on the way you look, it's headed for disaster, because we can't, and I see this, in men I treat who are in their 50s that cannot work out the way they did when they were in their 20s. They just can't. Their bodies just cannot sustain that, and it's devastating to them. So looking at that, in that area, the other thing is the other category is sort of what behaviors are they doing that are actually unhealthy? Because, again, individuals, let's say with anorexia, they're saying, well, I'm not eating any fat, and fat is unhealthy, so I'm doing something that's healthy. Most anorexic patients I work with really feel that they're healthier than the average person.
I've heard that.
And individual, men that I work with who inject anabolic steroids in their body, which is extremely unhealthy, but they see it as, well, this is what I do, and it makes me go to the gym, and I'm muscular and fit. That's healthier, but it's not healthier.
No, and certainly not to do the injection part. Wait a second, that's way outside the norm.
Absolutely.
And bringing someone's attention to the fact most people don't work out for 4 hours, and they certainly don't inject steroids.
Absolutely. And there are lots of, happy people that you can be happy and be overweight, and you could be happy and, that it's not that. The idea also is that individuals who fall into these categories, they look at these things somewhat simplistically. And people with ADHD particularly, I find that it's almost like we like the kind of instant answer, the instant gratification.
Yep.
So if we're this weight or if we look this way, then all of our world's problems will be solved.
Will be less.
We know. Right, and we know that doesn't happen. So pointing out to someone, I notice that you're working out 4 hours a day, and that's just, I worry about how healthy that is for your joints and for your bones. So it's not saying you're wrong, you're unhealthy.
Yes.
You're basically sharing I statements. Like, I'm concerned that this is, because no one can argue with you being concerned about something. The argument can be about, if you're saying, oh my gosh, you're crazy for doing that, or we don't want to shame people for these kind of
Exactly. As soon as that gets in, then the person escapes into what they've been doing, because that shame feeling you want to stay away from. And these excessive behaviors are in lots of ways that escape the shame.
Absolutely. And then the last category is the body image piece, that really getting a sense of asking someone, how, when you look in the mirror, how do you see yourself? And we know when someone is sort of at risk, when the way they see themselves is markedly different than how, knowing, of course, that everybody has their own perception. But again, people who struggle with eating disorders, with body dysmorphic disorder, they see themselves in ways that only they see themselves as. Other people clearly just don't see.
It's that extreme. So what resources are there, either for someone who has now realizes, wait a second, this is out of control, or for a family member in terms of getting professional help or even just getting more information about it?
Yeah, so I would definitely, first just even, and I appreciate us having this conversation, because body dysmorphic disorder in particular is still vastly under-recognized. That despite the fact that it's been, in the DSM and it's been out there's an abundance of research, it still is misdiagnosed or underdiagnosed.
Yeah, and completely missed. And
absolutely.
And if you don't know what you're looking for, you probably aren't going to find it.
Absolutely. And so there's a wonderful organization called the International Obsessive Compulsive Disorder Foundation, or the IOCDF. They're based here in Boston, where I'm located, and they are the umbrella organization for obsessive compulsive disorders and obsessive compulsive spectrum disorders. And body dysmorphic disorder is considered an obsessive compulsive spectrum disorder. And there are resources on their website of people particularly who are looking for resources for body dysmorphic disorder, for information. They have a wonderful treatment provider database where you can plug in your zip code, and it can tell you who within a certain mile radius specializes in BDD. So it is, you can check off BDD as one of the indicators of the different OCD-related spectrum disorders. Eating disorders, similarly, go to someone who specializes in eating disorders. That if you have a clinical eating disorder, it's you really need someone who has specialized training in that. And as we know, you and I know the importance of working with someone who truly gets ADHD, because and it unfortunately might not be the same provider that's an expert in both ADHD.
The thing I've certainly seen with all kinds of counseling. If the therapist doesn't understand ADHD, which is certainly wound into all that, it's probably not going to work too well. So finding kind of filtering that treatment provider directory into or just calling someone, what do you understand about ADHD?
Absolutely. And I've had, patients where they might have a great eating disorder specialist or BDD specialist, and then they'll reach out. And sometimes if they're in the area, I do work in all of those fields, but I could also do the consultation just on the ADHD piece. And sometimes even just meeting with someone for a consultation on the ADHD piece and having that person speak to your other treatment provider and say, look, just to let you know, this is the ADHD lens.
How it's going to work.
How we understand this exactly, and especially treatment psychopharmacologically. Stimulant medication has usually been vastly contraindicated in the treatment of eating disorders. I mean, eating disorder. Psychiatrists are very wary of prescribing stimulants because they're stimulants and they're appetite suppressants. But the data, and there are multiple research studies that have been done on this, great meta-analysis studies that have looked at, for someone with ADHD who also has bulimia or binge eating disorder, stimulant medication can be extremely helpful. And not helpful and not just helpful because it's suppressing their appetite, because it's not suppressing, it's actually regulating their appetite.
And it's helping some of that executive function stuff. Well, unfortunately, we have to stop our conversation now just for time limits, but it's certainly been a great conversation about a misunderstood and I think under-noticed problems and quite serious. If 20% of people with BDD commit suicide, this is a very serious thing. So, Roberto Olivardia, thank you so much for your observations and information about this important subject. We'll have written references on the website for ADHD Focus so that you can get this information and see it on the website. And for now, this is Dr. David Pomeroy signing off of ADHD Focus. We hope you've enjoyed the show and come back for other good topics related to ADHD.